So our first lesson is on preparing to act, and it is lesson 1A. There's also lesson 1B, which is acting in an emergency. You'll need the two of those for completing your first study guide. So first aid is typically initiated by someone either near the victim or someone who comes up onto the scene, and this person is absolutely critical in survival in some situations because it could be several minutes until advanced medical care arrives. The primary goals of first aid is to keep the victim's condition from getting worse, keep them alive, and make sure they get advanced medical care. But sometimes the most important thing a bystander can do is to prevent additional victims, which means their duties may end with making sure the scene is safe and keeping other people from entering an unsafe scene. So it just depends on the situation, always starting with the idea that you want to prevent additional victims and then give care if possible. Now, oftentimes people are reluctant to help and they're not sure that they can do a good job, but hopefully at the end of this class you do have the confidence that you would be able to go onto a scene and give care and help the situation as you wait for advanced medical care. It's good to have equipment with you that'll make you more confident. Having gloves and a mask in your car is a great thing to have because it's often the place you are when you come up on a situation where you would like to have some protective equipment. And so having those things in a first aid kit is always a good thing to have so that you can give care well and protect yourself at the same time. So the emergency medical service system, if you call 911, you will activate it. There'll be a dispatcher who will gather information and send help. The first people that will arrive are often emergency responders like fire and police, and then the EMTs, paramedics should follow, hopefully. So you're going to call 911 whenever you think there is need for advanced medical care. It might be the first thing you do because let's say you hear a car accident and you know immediately you want to call 911, but it might come later in your care when you come across someone who all of a sudden starts to be acting very strangely and you realize, okay, we might have an emergency here, a medical emergency, and we need to get the ambulance on its way. So you're going to call 911 for a lot of reasons that are very obvious, but you can always call 911 without getting in trouble, unless you're just prank calling, but you can call. The victim can refuse care. It's still okay to call. And even if the victim tells you not to call, they're not in charge of your phone and you can call if you choose to and you feel that it's necessary. Sometimes a paramedic can get to the scene and convince someone who needs care that they should get that care better than you could. So always call 911 if you think it's necessary. You also want to call 911 immediately if there's any kind of fire or anything like that. A downed electrical wire is a problem because nobody can go on the scene until that electrical wire has been investigated and someone has reported that there is no electricity into that wire. When you call 911, identify yourself, give them the phone number you're using, and then tell them your location and the number of victims. And then go ahead and just stop at that point and let them ask the questions that they need to ask. Sometimes you don't have a cell phone or someone else nearby that could go and get a cell phone. So if you are all alone and you have someone that you need to give care to and you have no cell phone coverage or no cell phone, you have to make a decision whether to call first or care first. And so the first thing that you'd have to consider is the age of the person. So if you have an adult victim, it's most likely that they've had a cardiac event, and the best thing to do is to call first. If you have a child, it's very unlikely that they've had a cardiac event, and a couple minutes of care might actually improve the situation or get them breathing again. And so if you have a child, it's best to give 2 minutes of care and then leave and go call for advanced medical personnel. And again, this only applies if you're all alone, don't have anybody else to send to get a phone, and you don't have a phone that has cell phone coverage. Can you be sued? Well, anyone can try to sue you, but can they be successful? The answer is if you are doing what you are trained to do and you're acting within your scope of care and you're intending to do good, then no, you are protected by the Good Samaritan law. And so if you are, again, only doing things that you're trained to do and intending to do good, and you don't abandon the victim, then you are protected by the Good Samaritan law, and they will not be successful in suing you. You are not legally required to give first aid care, but you do have a moral obligation. And I do think that people who have withheld care that I have talked to do deal with the guilt afterwards of not having helped in that situation. Again, remember that is a normal part of developing as an emergency responder, is that there may be an initial time that you don't do and go in and give care, and then that helps to build your confidence that next time you could have done something. So don't beat yourself up if you don't always run in like a fireman, but do remember that it's important that if you can help, to try to help, or at least offer your help. You do need to get consent from the victim if they're conscious. And so a responsive victim needs to give you consent to help them. The best thing to do is to say, I'm trained by the Red Cross, or I'm a trained rescuer. Can I help? And an adult victim can give you consent. For a child, you need consent from the parent. So anyone under 18, you need consent from the parent if they're around. If you have a child where the parent is not present, then you have implied consent. If the parent is not there, it is implied that they would want you to help their child. If you have an unresponsive adult, it is implied that they would want you to help them. So if you have an unresponsive adult that can't give you consent, you have implied consent, and you may begin. If you have a child who does not have a parent with them, you have implied consent from the parent that you could go ahead and help that child. If someone refuses care, a parent refuses care for the child, or an adult who is conscious refuses care, you may not touch the victim. This is called battery. And so you can talk to them, you can explain to them what's happening, what you think will happen if you do not give them care, and see if you can get them to change their mind. But otherwise, there's nothing that you can do physically. You can always call 911. No one can stop you from calling for a paramedic who might be able to decide whether or not they were competent and overrule their decision if necessary. But you cannot do that as a bystander responder. So your scope of care, those are the things that you have been trained to do. So after the class, you can do a variety of things because we've covered how to do all of these different types of first aid and emergency care. The standard of care is how we tell you to do it. So for example, CPR at the end of this class would be a part of your scope of care, and performing CPR with 30 compressions and 2 breaths is the standard of CPR. Examples of negligence is when you work outside of your scope of care. So you do something that you are not trained to do, like a roadside tracheotomy. I have not trained you to do that. No one has. You can't perform one of those. If you do, you will probably get sued. If you do something way outside of the standard of care, for example, you do CPR with your foot, that is, again, not within the standard of care, and you could get sued, and then and they may be successful. And the last thing is if you abandon the person. So if you start CPR, you're supposed to continue CPR until you cannot continue. So the reasons for stopping CPR would be you're too exhausted to continue, someone else takes over, the scene becomes unsafe, or the person becomes revived. Then, of course, you would want to stop CPR. So again, don't stop once you start CPR, but there are some good reasons. If you feel like the scene has become unsafe, you can stop and go ahead. Because again, what they're trying to avoid here is that a person doing CPR does not have the skills to declare the person dead. And so they want to make it very clear that once you start CPR, continue doing CPR until advanced medical care comes there and decides whether or not it's still a good idea to continue CPR. So just continue until someone takes over. If you are in some type of a situation where you've given first aid or care, it's important to keep confidentiality and to not reveal any information about the victim to anyone else other than the paramedics and the police involved. They may ask you to give a statement. They may ask you to come to the emergency room with them. Either way, just keep the person's confidentiality. And that's that. And we will see you for Part B, for acting in an emergency.